Some of the top healthcare providers and lawmakers in our community are just wrapping up an event right now aimed at finding solutions to what they call the vaping epidemic. Medical reporter Liz Bonis joins us now live from the event in Erlanger with what's being talked about. Liz?
Hey, Paula, good evening to you. We are once again at the St. Elizabeth Training and Education Center. We have been here talking about vaping and, more importantly, solutions to help lower the rates and the numbers, which are very high, well, all across the tri-state. With me today is Ben Chandler, because what we've been showing is some of the things you might not have known. You're educating parents. So, Ben, what is this?
These are vaping tools. This is a vaping hoodie. And you can use this hoodie, you basically hook it up to the vape up to the hoodie, and you can take a hit off of it through the string or whatever you call it.
Whatever you call it. Nobody would even know you're wearing it.
That's
yeah.
Right.
So these are the things that they're finding are getting vaping into school and whatnot. With me is Garren Colvin, the CEO of St. Elizabeth Healthcare, and you've been here today moderating. I know you have been behind this sort of effort to educate because
the epidemic of vaping in teenagers is getting too drastically out of control.
Yeah, you mentioned to me that some of your cancer experts say we've actually underestimated the number of people and problems that we'll have from vaping.
Absolutely. In fact, a cancer doctor this morning just told me that heard that there was some objection to using the term epidemic. He said 2 years ago, in 2017, when Jules came into business, that's when the epidemic hit. Now we're in a pandemic.
Yeah, so Garren's actually holding something that you would never know is actually a vaping device. It is a watch, and then can you pop that out for me? Right in that, as you can see, is a hidden cartridge, and you can vape with that as well. So I guess in summary, we're trying to find solutions here. Do we have some ideas from today? This was a great forum to get together.
Well, I'm with the Foundation for Healthy Kentucky, and we're pushing a law to try to tax vaping products. They're not even taxed here in Kentucky. We need to do that so that we can prevent this of what Garren called a pandemic. And it really is. We've got more than a quarter of our high school students vaping now. And it's a huge uptick, more than double than the last year alone. So we've got a serious problem, but we do think that we can meet it and hopefully fix it.
Okay, so I think today was at least the first step in that. Over the next couple of weeks, there's some legislation. I've already talked to one of our legislative people in Covington. We will be sharing more with you about that, and those of you who want to find out more and get involved, we'll let you know that too. Paula, we'll throw it back to you in the studio.
Wow, Liz, if you could, that little device was a vaping device, obviously meant to be disguised. Hard to make a point that they're not aiming for kids if they're trying to disguise it like that, right?
Yeah, so true. Paula was mentioning that you've got to be aiming at kids if you're taking a little thing like that.
Both these devices are targeted at kids, and that's why one of the legislations that we're trying to get passed would be a 21 law. So you'd have to be 21.
All right. Well, we all know you're working toward the same goals. We'll continue to follow this, and we'll update you as we can. We're live in Erlanger. Liz Bonis, Local 12 News.
Interesting day. Thank you, Liz, for that. All right, now look.